It's entirely normal to have fluctuations in plaque and saliva throughout the month. We're talking about women's oral health and we're talking about the menstrual cycle. Why are they connected? Well, they're connected because of hormones. Menstruation is very personal. It has names. Some people call it Aunt Flo. Some people call it their best friend. For me, it's like my evil twin. For those of you who are my generation, used to watch I Dream of Jeannie, and she had that blonde hair, that blonde ponytail, but when her evil twin came through, she had that jet black hair and she was always playing games. I call her my evil twin because now I'm at the age where she just pops up. She might be unannounced. She might come twice a month. She might jet out and not come for a month. We get our menstrual cycle in puberty early in our school years, and she stays with us for a long time. And as we get to know her, we know her temperament. We know what we can and can't do. What's important is for us to think about oral hygiene as part of our overall personal hygiene. And for young women, especially, to understand that you may need to care more for your teeth and your gums at different times of the month. And that's just because of the hormones. You think about the phases. Start with menstruation. You have your period, the hormones are pretty low, and you're really just focusing on getting through the day with the period. And then about a week later, the hormones start to change and the estrogen picks up. Theoretically, you would have more saliva. So your saliva may be more watery. That's something to think about, the consistency of your saliva. And then, another week or so, your body goes through ovulation. And that's a peak. It's not a whole week. It's just a few days. And in ovulation, you have a surge of hormones, but your progesterone is still pretty low. Progesterone, when that comes in the luteal phase after ovulation, you might have more plaque. When they do research in gum disease and patients that have lost bone, they will look at progesterone levels. So researchers pay attention to estrogen and progesterone. In terms of thinking about your personal care, it's really about your hygiene, understanding you need to brush, floss, and rinse, keep everything at a healthy balance, and really understanding the connection that our oral mucosa is very similar to our vaginal mucosa. In structure, the mucous membranes are present. It's a moist environment. It has its own ecosystem full of fungi and bacteria and viruses. It has to be at a nice harmony. It doesn't want to get too angry and it wants attention. It's important to know how to clean your mouth and the rest of your body with regards to your own pH balance, your own sensitivities, and also understanding that our oral mucosa and our vaginal mucosa are also attached to our immune system. So they play a role. Immunity is very important. And what that means is your nutrition, your general health, and also systemic health. When we think about imbalances in the mouth, we think about inflamed gums, gingivitis, even gum disease. Down below, our vaginal mucosa may go through other changes, bacterial vaginosis and other things that can fester down there. So it's really important for us to understand that it's entirely normal to have fluctuations in plaque and saliva throughout the month. Something that I've noticed as I've gotten older is right before my cycle, I get a little sensitivity. I feel sensitivity around my gums. And it stood out to me when my son was born because I thought that it was from trauma. Sometimes you're playing with a baby and they may hit your chin and your teeth may go through a little mild trauma. So I thought, oh no, I have a toothache. Maybe I got an infection. Maybe my tooth is loose. But then it would go away. And it's not every month, it's just every now and then. And I realized that it's actually my gums. My gums are a little more sensitive, not all over, but in my lower front. And so that's something that has changed over several decades. I didn't have that when I was younger. And it's something that I'm noticing now, especially as I'm going through the changes through perimenopause. I'm not in my 30s or 20s, I'm in my middle 40s, and I'm going through fluctuations of hormones. And I'm going through changes in my oral mucosa, and I have to, be sensitive to that. So that's what I wanted to talk to you about today. Just maintaining good oral hygiene and understanding your own personal chemistry throughout the month. All right, hopefully that gives you guys a little insight on the connection between women's oral health and menstruation.